Dr. Tim's Pain-Free Podcast is produced with you in mind. We are on a mission to better educate the world about living a pain-free life without drugs or surgery. Help us by spreading the word and sharing this podcast. Thanks for listening.
Hello, everybody. Welcome back to Dr. Tim's Pain-Free Podcast. This is our 6th episode.
Wow,
So, right?
6 already.
Again, I'm Dan. This is Dr. Tim. We're here today. What are we going to talk about?
Today we're going to talk about regenerative medicine.
Regenerative medicine. This is an exciting topic, probably one of the biggest breakthroughs in our lifetimes. Right?
It is. And there's so much information out there and there's so much misinformation that we wanted to just take the next 20 minutes or so and kind of give you some idea as to where to begin when you start thinking about, do I need regenerative medicine, or what could it do for me, or someone that I know and that's dealing with maybe a worn out joint and they need something regenerated.
Like a bad knee.
A bad knee.
shoulder.
Knees are the most common, yeah.
Okay.
And so, regenerative medicine, just by definition, is using any product, even from taking something out of your own body and putting it back in, or putting a product in that helps the body to redevelop, regrow, regenerate, heal over tissue, reconstruct, replace, or supplement what you already have to make it better.
Okay. And there's a lot of research, like you say, even going through our research here, we came up with as many questions
That's
as we
right.
came up with answers.
So yeah, if you're looking for answers out there, I feel your pain because I did a lot of research in preparing for this, and we've been doing this in the office now for almost 3 years, and there's a lot of information out there, and you don't know where to begin. You don't know what's the difference between cytokine and a whatever and all these different scientific terms, and I'm going to try and keep it real simple. It does have a little bit of science in what we're going to talk about today because you got to have an understanding and a baseline of what it is we're dealing with here, but basically we're dealing with stem cells.
Stem cells.
That's the catchphrase of the day. That is
Right,
regenerative medicine.
stem cell therapy.
That's right.
Okay, so we probably should back up a little bit and figure out how we got here.
Actually, when you Google search and figure out where it all started, you'll get sites that comment things like the Native American Indians back in 14th century would eat their afterbirth, after their child was born, out in the field and in their teepee or whatever.
Yeah.
And
it
had some sort of they knew that something was to that there was some healing capabilities there, and it was very healthy, so they would eat it. We don't practice that today in the United States, but the scientific research that we can find dates all the way back to 1913.
Wow.
And in 1913, they had a patient who had some ulcerative skin conditions where he had been burned and it was not healing properly. And so the skin was taking longer than normal, and they actually took an amniotic sac, the membrane of the amnion, and they placed it on the wound, and within a short period of time, the skin healed. And so they knew there was something that would regenerate from that tissue. We know now that what they were using in that amniotic sac was growth factors. And the growth factors were then attracting all those stem cells that the body has in it naturally to that area, and they healed it. And so, then more and more time goes by, and research happens to where the first bone marrow transplant happened in the United States, actually in 1956, if I have my dates right here. Yep, the first bone marrow transplant. It was actually done between a set of twins where they were biologically identical, and one twin had leukemia, the other one didn't. And so they took the bone marrow from the healthy little girl and they transplanted it and injected it into the girl with leukemia, and it healed her leukemia. It actually regenerated the red blood cells and the white blood cells and everything that was needed to take care of the leukemia. So that's it's not brand new, even though you hear stem cell therapy now on the radio and it's like the catchphrase and it's real big. Bone marrow transplants for cancer patients have been around since the 50s. And then in the 70s, they started even treating like lymphomas and various different conditions with success using bone marrow transplants.
Okay, you used a lot of terms already, so let's back up and define some of them. So give me the definition of stem cell.
A stem cell is the basic building block of your body. So a stem cell is kind of like the blank canvas is to the artiste. it can become anything that the artist wants it to become. And in our situation, if you think back to the very, very beginning, when a sperm cell fertilizes an egg cell, and you make a baby, well, the only thing present in that environment is, inside the uterus, there's one fertilized egg cell. And then all of these growth factors and these stem cells are also present, and the growth factors have particular coding in them that connect with the stem cell, and they tell that stem cell what to become. So within a matter of days, you start to get the central nervous system inside the baby starting to develop, and it's because the growth factors that are marked for the neurology are coded to say, we need stem cells recruited here to make this. And then those same stem cells are then coded and connected and paired with other growth factors that now make it become other things. And so all at one time, simultaneously, the embryology is happening, and the embryological changes are happening, and you're getting a placenta developed inside an amniotic sac, and cells are rapidly multiplying and dividing, and growth factors are providing the groundwork so that tissue, that lattice work, can scaffold and connect and make and form into a baby, so that 9 months later, started with one cell, now the baby has over 100 trillion cells, and it's a perfect little baby that has all the systems, all the tissues within each system, and all the cells within every tissue that make up a complete baby. And it all started with a certain amount of growth factor and a certain amount of stem cells. And those stem cells are the only cells in our body that not only differentiate by becoming other things, they proliferate and become more of themselves. So you got X amount of stem cells, and as they become other things, they're producing more of themselves so that they can then become other things, and the cycle never stops. And so we as adults even have stem cells in our body. That's why you can do a bone marrow transplant. I could take out my stem cells that I still have as an adult, and I could give them to you if there was a perfect match. And so that's actually called an allograft, where you get someone else's tissue put in your body, right? Okay. And so the difference between allograft and autograft is where autograft means it comes out of you and goes back in you. Like my wife had a knee reconstructive surgery after she tore her ACL, and they took her patellar tendon out and they remade it into an anterior cruciate ligament, and they put it back into her. So that's considered an autograft. Autograft. Like not autograph, but autograft. Right. Yeah. Like a skin graft. That's how I think of it. They're taking a skin part of skin off of here, and they're putting it onto here. That's an autograft of a skin patch.
You can have an allograft of a skin.
You can have an allograft. Sure. Okay. You can have an allograft. You can have in fact, you can have, the third term is called a xenograft. And a xenograft is where you are taking a part from another species and putting it in a person. And so that's common, like in heart surgery when they're doing valve replacement, they'll sometimes use a pig valve. Yeah, pig. It sounds kind of weird, but they'll actually, the pig valves fit sometimes better in the human body than trying to fabricate something that will wear out. They also use pig tendons sometimes to make ACLs or different types of tendons. You've heard of like cat gut. I've heard of that term. When I played tennis back in high school, the strings were made of cat gut. It was actually the gut of a cat. So they're stripping these intestines, and those cat guts are used in surgeries as well inside of people, and that's called a xenograft. So you got allograft from someone else, autograft from yourself, and xenograft from a different species that can go into the human body and make it work.
Man, the thing that just strikes me is that God made an incredible, amazing body here that we...
That's right.
And just unbelievable.
It is. Yeah. It is unbelievable when you think about going from one cell to 100 trillion and how everything works not only so amazingly well, like designed, but simultaneously. It's just all happening. You got a woman that has nothing inside of her, but she's producing eggs, and then within days and weeks, she's producing something that did not exist before that. Not just the baby, but the environment the baby is growing in. She's creating the sac. She's creating the placenta. She's creating all of these stem cells and regenerative growth factors, and she may not be producing the stem cells, but they're being produced in that environment because that sperm and that egg got together and voila, magic happened. In more ways than one.
Yeah, that's probably why there's so many questions out there too, because it always seems, when I was reading and studying up for today's show even, it seems like there's always one part in there that says, and then a miracle happens. And then you see what the rest of the result is.
That's right.
There's
you can't really scientifically say, how did it form out of nothing? The stem cells weren't there, but now, because they're making themselves.
And then a miracle happened.
That's right.
All right, well, there's a lot more that we can learn about this, and I'm sure we're going to take a deep dive into this, all the different kinds of stem cell therapies that there are.
You bet.
So we're looking forward to you hanging out with us, and we'll learn more right in just a minute here on Dr. Tim's Pain Free Podcast.
Thank you for joining us on Dr. Tim's Pain Free Podcast. For more information, visit www.trinityintegratedmedical.com. Now back to the show.
And we're back with Dr. Tim's Pain Free Podcast. Today we're talking about stem cells, stem cell therapies, regenerative medicine. We talked a little bit about the different categories with allografts and autografts, xenograft, right? So what are the specific types of therapies that there are?
Okay, so the category being regenerative medicine has the different lanes that we'll call the different products basically. And one of the first products that's been around for a long time is called PRP. And PRP is an acronym. It stands for platelet-rich plasma. Plasma is in our blood. And so what happens in the case of platelet-rich plasma injections or PRP therapy, they go to a person, it's considered an autograft, they take it out of that person, they then put that blood sample that they've drawn out of the patient into a centrifuge, and it spins. It actually spins twice for about 10 to 15 minutes each time. And so that separates that plasma from the RBCs, the red blood cells. And so when you look at a test tube that's been spun, it's two different colors because it's separated. It's like the thick stuff goes to the bottom and the thinner stuff goes to the top. So that platelet-rich plasma is where all the growth factors are found. And so then they draw just that portion back out of the test tube, and in the same visit and put it back into the person that has the need for some sort of treatment like this. It's very common in soft tissue injuries. First time I ever heard about it was when a professional golfer, actually had some severe tennis elbow. That's how he makes his living. He can't swing a golf club because he couldn't hold it. And that typically can take months to heal. And after PRP injections into that tendon, which is kind of avascular, putting all that growth factor directly in the spot, those cytokines and various markers in that growth factor cause the stem cells to come to that area and heal that tissue. And so it works well for the younger population. It's most recommended for someone who's an athlete and younger, maybe in that 15, 16 age to maybe 25 or even 30. If you get older than that, then the growth factor is not as young. So it's not as viable and it doesn't work quite as well. So there's other things that are better for you as you age. But that's the first one, PRP.
And that's in the regenerative medicine category, but it's not necessarily stem cells.
It's definitely not stem cells. There's no mesenchymal stem cells that are injected into the body at that point, right?
But the idea is you put the PRP into the injured area and it draws the stem cells that are there already in our body.
Right. We already have them, but they don't know to go exactly right there. But that platelet-rich plasma has those little markers and cytokines in it that say, over here, fellas, and they bring all of the attraction of stem cells to that area to help regenerate.
Okay,
new
that
tissue.
makes sense, PRP.
That's PRP.
Okay, what else you got?
That's an autograft, by the way.
Right, from your body.
From your own body. You wouldn't PRP my blood to you.
Gotcha.
We'd have to match blood types and all that for that to work.
Okay.
So the second category would be amniotic fluid. In that same category would be the matrix, the little connective tissue, as well as the layers of the amniotic sac, which is the amnion and the chorion. The inside closest to the baby and the outside that protects the baby from the rest of the mother, the womb. And so all those are kind of in that same amniotic category. The amniotic category, it doesn't have any true live mesenchymal stem cells, but it's loaded in growth factor. Now you get these from a a pregnant mother at birth of a live delivery. So you're talking day old with all the maximum amount of growth factor, because it's just been through the process of creating this baby from nothing, basically.
Right.
And so it's loaded with growth factor, and you can, you buy these from a company, and they ship them to you, and we inject them into patients in the office. And it's just loading them with growth factor, and it's kind of doing the same thing PRP is, except it's like PRP on steroids, because the growth factor is way much more concentrated in higher levels than in the PRP that comes out of your 40-year-old blood or 50-year-old blood, right? So the amniotic layer, there's different things in there as well. Like the amniotic fluid has hyaluronic acid, which is a lubricant that our joints produce and need. And so you're putting that in along with that growth factor. And those cytokines, again, there's scaffolding cytokines, and there's blood delivering cytokines, and there's all these different types of cytokines that are basically the proteins that are the markers to say attract the stem cells to this area. We need healing here, exactly. They kind of are based on the inflammatory markers that you have. If your body's inflamed, then it says where, and it tells it where to go.
So this is getting those growth factors, but you get it from the amniotic fluid that the baby's been in for 9 months. You can get that fluid, and that has all those things in it.
That's right.
So you can put it in somebody else.
That's right.
That's
That's
allograft.
Allograft.
Okay.
Yep. So that's amniotic allograft. You'll hear that, amniotic allograft injections, or amniotic allograft therapy, and that's what they're doing. They're putting in a substance that is going to cause your own growth, your own stem cells to be attracted to that area. There's no stem cells in that product.
And I think this is part of where the confusion comes in, because a lot of people call that stem cell therapy.
They do.
And it is stem cell therapy because you're getting your own stem cells drawn to an area of injury, but that's not the same as stem cells, as putting stem cells in, right?
Correct, yeah.
Some people think that I'm getting stem cells.
Right.
But they're getting stem cell therapy because they're just getting growth factors.
That's right.
And that's something to be aware of.
And the FDA has come down on certain doctors who are doing this just because they're advertising it incorrectly. They're saying we do stem cell therapy, and they look at their product and it's really not stem cells.
Right.
It's amniotic allograft. And so there's debate in the industry of, can you call it stem cell therapy if there's no stem cells?
Right, because we're trying to attract them.
That's right.
It's a gray area.
It's a gray area, but the difference being to be clean in the FDA's eyes, you need to call it what it is, and that's amniotic allograft.
Okay.
And so if you see we use amniotic allograft on an advertisement, then they're not using any stem cells. They're putting the product in that causes your body's stem cells to go to that area.
And those are by definition older than.
Absolutely.
They have to
Even
go
though they've been
within a 0
regenerating,
baby.
because we regenerate all the time, they're not as viable at that the older we get. And this is the market for stem cell therapy and amniotic allograft therapy, anything regenerative. Pretty much one of the main factors is if something's degenerated, which takes time, and so age is a factor. Mm-hmm. So most of the patients that come in and they're interested in something regenerative, they're not 20, 30-year-old people.
Yeah,
they're
60s,
in their 50s, 60s, and 70s, and the age is a big factor that's caused them to wear and tear over the years, and so we wouldn't want to take their own cells out and put it back in them and give them, tell them they're getting the best thing out there. That's not the best.
The PRP wouldn't be appropriate. For
PRP would not be appropriate at all. It's probably not good after, we wouldn't see a patient get recommendations for PRP therapy that were in their mid to late 20s. They're already too old for it.
Oh, okay.
Yeah.
Oh, wow.
So, but you get a 16-year-old, it works pretty good. They got a lot of growth factor and stuff in their body already. But,
Yeah. So PRP, amniotic allograft.
Yep.
What else you got?
We've got umbilical cord blood and umbilical cord matrix. So inside the umbilical cord that connects that placenta to that baby that's growing in utero, then you have the umbilical cord that manufactures something called Wharton's jelly, but also in the center of that umbilical cord, you've got the blood vessels. So you've got
The artery.
the umbilical artery and vein.
Mm-hmm.
Okay, and so if you talk about a cord blood product, you're taking the blood from that umbilical cord artery.
Okay.
And that blood does contain stem cells, but they're not mesenchymal stem cells. And so I'm going to get a little scientific. There's more than two, but the two types of stem cells that we most commonly talk about are called mesenchymal stem cells or hematopoietic stem cells. Say that.
Very poetic.
That's right. So hematopoietic is dealing with all things blood. It comes from the cord blood, the vessels inside the cord. So those stem cells are very beneficial in producing more blood type cells. And so that cord blood can be used to treat blood-borne disorders or like a leukemia or or an autoimmune disease that a person's suffering with.
Because it's a blood product. So
It's
you
a
can't
blood
mix
product.
It with, you can't inject it into somebody's knee.
No, because it would bring in blood.
Yeah.
And not soft tissue, connective tissue stem cells, the kind that produce that result, like cartilage, ligament, tendon, muscle, bone. All those
are mesenchymal.
Those are mesenchymal stem cells. And so when you got cord blood that only does hematopoietic stem cells, the opposite of that is the Wharton's jelly. So when that baby is developing, to keep the blood flowing to that baby, it's got the umbilical artery inside the umbilical cord, and all surrounding that artery to protect it as a layer, it's got this soft gelatin-like substance called Wharton's jelly. It's actually called a jelly. You know what jelly is, right? Grape jelly.
Yeah.
So that's what
With a name like Wharton's.
With a name like Wharton's, yeah. So you've got this Wharton's jelly that for every centimeter of umbilical cord length, it contains in the Wharton's jelly 240,000 mesenchymal stem cells.
Oh, it's packed.
It's packed. It's
Okay.
loaded with, that's where those stem cells are then going from that cord into the amniotic sac where the baby's forming, and growth factors are helping it lay down like as fast as you could build a brick wall.
Yeah.
Boom, 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 boom. They're just happening. So it's all producing right in that umbilical cord. And that Wharton's jelly, not only is it 240,000 stem cells, mesenchymal stem cells per centimeter, but if you take the fluid, that jelly out of the cord, for every milliliter, there's 2 million stem cells in 1 ml. That's a tiny little amount of volume of fluid. And so it's loaded with them. Mm-hmm. So the American Indians knew something way back in the 14th century that
trial and error. Yeah.
We didn't know. I don't know how they do that. We don't eat them now and digest them. But anyway, I digress. But
so the Wharton's jelly, though, is the product that has a mesenchymal stem cell. That is something that you inject in injured areas.
That's right. You inject that into injured areas because the mesenchymal stem cell is the one that can then match with growth factor to form cartilage, to form ligament, to form a labrum in a shoulder, or plantar fascia in the bottom of a foot. We've seen it heal meniscus tears like acute tear. Someone presents with a bad injury in their knee, and luckily they didn't tear their ACL, but their meniscus cracked. And so they're having trouble getting around on it. We inject that. We've had root tears, which are pretty aggressive tears of the meniscus, where part of the meniscus has torn and it's kind of a flap. And we put a stem cell product in that with the mesenchymal stem cells, and it helped regrow that attachment so the meniscus is back intact again. Okay. So we've seen it happen with cartilage, ligament, muscle, tendon, you name it, we've seen it. That's the mesenchymal stem cell.
So you put the bricks in there, you put the mortar in there, you put all the tools in there with one injection.
That's right. One injection. You get about
one growth factor.
The injection for degenerative knees is a 1.5 milliliter injection, because not only are we putting the stem cell in there, we're putting in a fair amount of growth factor. And that's a different product within the same category. One of the Wharton's jelly products is called the Matrix. Okay. And that's like the scaffolding. And the other one is just stem cell. So, and there's HA in both. Hyaluronic acid, which is that lubricant. So we always go back to the example of knees because that's the most common stem cell therapy or stem cell injection, but it's helping it build new cartilage. It's helping it put cartilage on the end of the bones so that every step is not a painful step.
Okay, so you got PRP, you got amniotic allograft, you got umbilical, right, the blood and the Wharton's jelly.
Yep.
Okay, are there more?
Yep, couple of other places that we find stem cells, and that is one is from the bone marrow transplant. So it's called it's a bone aspirate, where they literally take a large diameter needle and they tap it with a hammer into, say, your hip bone. And as it goes in, it gets past the outer part of the bone and into the soft part, the marrow. And they pull it out, and then they have bone marrow. And then they spin it in a centrifuge, and it separates mesenchymal stem cells. And then they can re-inject that back into you. That's what a bone marrow transplant is. It's putting one bone marrow into another person, or transplanting it. Well, if you did it on yourself, it would be an autograft, a bone marrow autograft, and those they can't be manipulated once they take them out of you. And I don't want to get too detailed here, but you've heard stories of professional athletes that have gone overseas and they've gotten some sort of stem cell therapy. Yeah,
South America.
Kobe Bryant, Peyton Manning, you can name Tiger Woods, lots of big name people that have gone overseas to get this done, because the FDA has said that any tissue taken out of a person's body has to be put back in on the same visit. Okay. What they're trying to prevent is the manipulation of that tissue. And so you can spin it, that's considered minimal manipulation. And so when in these cases, these guys that have gone overseas to get this done, they may have their blood or mesenchymal stem cells taken from their body and then put in a culture and grown so they can multiply and divide along with all the growth factors and everything. And then say they took out 1 ml of your body and it had 2 million in it. Then they grow it for 12 weeks and now it has 20 million cells. And so in America, you can't inject that back into you, but you can fly with your stem cells to Germany, say, and a German doctor can put 20 million stem cells back into an injured area. Kobe Bryant did it with his knees when they were starting to wear out and degenerate. He tore his Achilles, and they said, you got bad knees too, and if you have better knees, then you're going to heal your Achilles after surgery better. He had a complete rupture of the Achilles. Well, he had his knees done, and then he went on to play basketball, a dozen more years. So that's one type, and that is true mesenchymal stem cells, and it can be autograft or allograft. You can get a bone marrow from someone else. And the last category that we have is kind of like that, but it's called adipose extraction.
Adipose is fat.
Adipose is fat. And so instead of getting a hammer in the side of your hip and taking out bone marrow, they actually do like a liposuction type of thing. They get it from your abdomen, so you lose a little weight on the side, as a side note. But no, they do a liposuction, and they pull out fat cells, and then they put it back in a centrifuge, and they spin it, and as it spins, it separates fat from stem cells. And so then you got X amount of stem cells, and that's, up until the last few years, has been probably the best thing for osteoarthritis to re-inject back into a person. They'd take your stem cells out of your fat, they'd spin it in the same visit without growing or multiplying them in number. They'd put them back into your knee, for example, and your knee would then grow. But again, that's using your stem cells that may be 40 or 50 or 60 years old, and not this product that we've counted and know how much is in it and can verifiably say this is what you're getting. It's not trial and error, it's not guesswork.
Which is a great segue into the products. What products do we use here at Trinity Integrated Medical?
That's a great question. We started out about almost 3 years ago now using an amniotic allograft, and we got incredible results with that. We had patients coming in, and they had shown improvement on every functional eval, and they had shown lots of change on x-ray. But over time, as the science continues to come out and the products get better and better, we've most recently, in the last, say, we've been over a year now, maybe a year and a half, 18 months or so, we've been doing the product that comes from the Wharton's jelly. So we're not injecting the allograft that causes your body to produce stem cells. We're actually putting stem cells, growth factor, and hyaluronic acid back into that area and letting those happen. One of the reasons being is research came out that the actual research was done in 2013, and I learned about it in 2017, and that was the University of Utah had done a study on the viability of stem cells that are 1 day old from a a healthy baby born, healthy born baby, live delivery, all that. They compared that to the adipose fat that they took out of an elderly person's spine and put back in them. And they put both these products in, and they determined that the brand new day-old stem cells were 60% more effective at healing and regenerating than, like I said in the last podcast, the old out-of-shape stem cells that were just putting back in the same person.
Okay.
So that's why we switched to that product. We use a Wharton's Jelly product. It's mesenchymal stem cells along with HA, along with growth factor. Now, the cost difference that I want to tell you is one of the biggest things that gets me going, and that is people that say, oh, it's stem cell therapy, amniotic allograft is the same thing, and then they want to charge you $4,000 or $5,000 for that treatment. Well, that cost should be that high if they're using true, live, viable stem cells. If they're using mesenchymal stem cells, Wharton's Jelly derived are the best. If you're using that, then that's the cost of that product. But if you're using amniotic allograft, amniotic fluid, amniotic matrix, membrane, those don't contain anything but the growth factor and a little bit of HA, and they're putting that in you, and if they're charging you the price of a stem cell, then they're ripping you off, literally, because the product in that range is like the $800 to $1,500 range, as opposed to $4,000 to $5,000 range for the true live stem cells.
Right.
So just know what you're getting. One's not bad and one good. They're both good. One's better, I believe, hence the price. But if they're selling you the subpar quality of product because it has no stem cells, but they're giving you the premium price and calling it stem cell therapy, then you just aren't educated and you fall for it.
Adds to the confusion.
It does add to the confusion because there's lots and lots and lots of confusion out there.
But we've seen the results. We've seen with people's X-rays where their knees
Absolutely
has a bigger space than it did
before. And everyone that'll let us X-ray them again, most people are off running on the beach somewhere because they feel so good. We have a good follow-up system in our office where we're keeping in contact with all those that have gotten the stem cells, say in their knee or shoulder, and we've either released them from a couple of months worth of rehabilitation and they're at full force, be it a shoulder or a foot or an ankle, and they're actually performing the rehab 2 months post-injection better than prior to the injury that got them in the office in the first place. They're like stronger, quicker, have better endurance because of these stem cells. And then when we follow up with the knees, because we're looking at the spacing on x-rays, we do that at 6 months and at 12 months. We've never had a patient that actually didn't at least halt the process. And that bone-on-bone usually has now a space that's been generated. What is that tissue in there? Well, it's most likely cartilage. We don't do pre and post MRIs to see the thickness of the cartilage. We see the spacing between the bones, and we see that space improve. So that's what we're looking for.
Yeah. So this is an incredible breakthrough.
It is.
Right.
Definitely is a breakthrough. The way they're cultivated now, the way they're gotten and so easily distributed to clinics like mine from various tissue banks, that there's lots and lots and lots of different labs and different companies out there doing this, but the one that we've chosen to go with is really, in my opinion, and not only my opinion, but in many scientific world people's opinion, is the best. And that's because they're one of the only, they're the only that I know of that's publicly traded. Mm-hmm. They're on the NASDAQ. You can look them up. It's called Predictive Biotech, and their letters on the ticker tape or whatever are PRED for predictive. It's Predictive Technologies Incorporated. They're publicly traded. They have
a great website. Right?
Great. Oh man, their website is second to none. In fact, I wish I would have started there in preparing for this and for all my talks that I do with patients, because they have a wealth of information. I mean, just unbelievable amount of talking about the process of how they're gotten, talking about the screening of the mom and the dad prior to that pregnant mom giving birth. 7 days prior to the birth, they're actually testing both parents and screening them, making sure their health history is good. And And then when that baby's born, the website talks about the process of how that tissue is gotten and how it is shipped within X amount of hours to the lab, where it's then frozen after the parts have been separated into the different products, and the stem cells versus the amniotic fluid. They get it all, and then they do their stuff, their work on it at the lab. And they're also one of the only companies that owns their own lab, and so there's no third party, there's no middleman. And so there's another company, I won't name them, but just recently in the last couple months they've come under a lot of scrutiny because they had some happenings at their lab that affected their product, and they're out here selling this product, and the lab is having issues with contamination, and so they're putting contaminated products on the shelves in doctors' offices. And so this company, Predictive, they control the process from the very beginning, screening the parents prior to the birth, collecting the samples, freezing the samples, testing the samples, sending the samples to the various doctors' offices, and at that point they don't have anything to do with it. The doctor then thaws it when it's appropriate, and they inject it into the patient within minutes, and so there's less loss of live viable stem cells.
I know when we started doing mesenchymal stem cells here, that's when we got the nitrogen freezer.
That's right. So
'Cause they have to
we keep our stem cell samples that we put in patients in a liquid nitrogen tank, and so it's this giant tank that you got to wear the special equipment to get the stem cells out, and they're frozen solid at negative 196 degrees.
That's cool.
That's cold. They're rock hard. We gently, minimally warm them up in our hands by just rubbing them back and forth until they become a little bit chunky, like ice melting, and then we take them into the provider's office that's actually going to draw up the liquid into a syringe, put it in the knee. The whole process from thawing to end takes about 20 minutes, but the actual injection is an injection. It takes as long as
Just like that.
they find the landmark and they put it in and they insert the product, and it's done.
And then the product starts working, and how long?
Noticeable difference within the first 1 to 3 or 4 days, and that's primarily because of the amount of HA that's in the lubricant that's in the product. It's natural HA. A lot of people have tried like a synthetic for their osteoarthritis of the knee, something like a Suparts or a Euflexa or Synvisc, Genvisc, all the different types of product out there. If you want to know more about that, then listen to episode 5, because it was all about knees, and it was not just stem cells, it was all about the HA as well. But this HA that's in this product that we use lubricates the joint, and the patients feel almost an immediate reaction, like, wow, it felt better. So that's letting them know that it's headed in the right direction. And then we expect a functional change, like the better ability to climb stairs, the ability to squat when you haven't squatted, the actual function of the joint. We expect that to change in about 3 to 4 months. And then at 6 months, we take a secondary x-ray to see how much growth we've had, and then we take another one at 12 months. And at 12 months, most research and literature will say that the effects of that stem cell are no longer rapidly laying down the new tissue, because it's not a brand new one anymore. They're a year old because they've been in you harvested and growing for a year. And so at that point, sometimes we'll recommend, if a patient was really, really worn out and they still have an issue here or there, or they've gotten back 50 or 60% and they're way better off, they're squatting, they're not going up the stairs sideways anymore, they're not using their walker anymore, but they still have some room for improvement, at that point we'll introduce more growth factor into their, and that's the lesser on the expense side of things, a lower cost product, but it'll kind of jumpstart that process of stem cells being back attracted to that thing. After a year, we'll do that sometimes.
Okay. It makes sense because it takes 9 months for a baby to grow.
That's a good point.
Right?
Yeah.
Okay. Well, that's exciting news. It's good stuff.
That's right.
Anything else to add?
You know, I'll mention the website again because I'm so impressed with it. It's Predictive Biotech, PredictiveBiotech.com. On there's a portal for doctors to go in and look at their accounts, but for the general public, there's a wealth of information about the company, about the products, about how they're gotten. Is that a word, gotten? I keep saying it, but how they're extracted and how they're frozen and saved, and the differences between the products, and kind of the bits and pieces that I put together for this presentation. But I didn't use that site to do this presentation. I found it afterwards, so it would have been helpful. But you can find out lots of information on that site. So go to predictivebiotech.com and you'll have your questions answered. If you have new questions that you can't find on there, reach out to us.
Absolutely.
Right? That's the easiest way to contact us.
It's not really a decision that you would make on your own. You can research all the products, but you need a healthcare professional. You need somebody to look at it, because you got to qualify for different products.
That's right.
Right? So
Sure.
you need your healthcare professional. Certainly we will help you here at Trinity Integrated Medical. But if you're not in the Dallas area, if you're watching from some other state or whatever, get a healthcare professional, look at the options with them together, see what you qualify for, have some x-rays done, and then go get a second opinion. Maybe there's different variations of things that you could get that would help you. So that's what we want to do here. That's what this podcast is about, helping people live a pain-free life without unnecessary drugs, unnecessary surgeries. I think it was a great show. I think it was very informative. I learned some things.
Yeah, good. I hope you heard it and you listened long enough to catch all the good stuff. And you can comment in the sections below on these videos, wherever you're watching them from. And reach out to us. Ask questions. Tell us about things you want to hear about on this podcast. Because, again, we're trying to deliver pain-free state of being to people so that they can function and move. Because, if you lose your motion, then you've lost your life. Motion is life. And we can help people with regenerative medicine, I believe, by achieving their motion back.
Yep, I agree. So like us, share us on your social media, and come back next week and join us right here on Dr. Tim's Pain-Free Podcast.
Thanks for joining us on Dr. Tim's Pain-Free Podcast. While I make every effort to broadcast correct information, I'm still learning. I will double-check all of my facts, but realize that medicine is constantly changing. One doctor may have a different way of doing things from another. I'm simply presenting my views, and the opinions are solely of my own. I welcome any comments, suggestions, or correction of errors. I take no money from drug or device companies. By listening to this podcast, you agree not to use it as medical advice to treat any medical condition in either yourself or others. Please consult your own physician for any medical issues you may be having. This entire disclaimer also applies to any guests or contributors on the podcast. Under no circumstances shall Tim Usselton, D.C., Dr. Tim's Pain-Free Podcast, or Trinity Integrated Medical, or guests or contributors to this podcast, or employees, associates, or affiliates of this podcast be responsible for damages arising from the use of this podcast.